morning. My name is Leticia Seguera. I'm a physical therapist assistant student at EPCC, and today we're going to perform some manual muscle testing. Hi, how are you?
Good. How about yourself?
Fine, thank you. Today we're going to perform some manual muscle testing. Is that okay with you?
That's okay.
Okay. We're going to work on the neck. So the first test is the capital extension. Can you please go ahead and scoot forward all the way to the side of the bed? Okay, and with your arms like that. Thank you. Can you please go ahead and look at the wall? Okay. And now we're gonna do the same thing. You wanna go ahead and take a look on the wall, but I'm gonna apply some resistance. Is that okay?
That's okay.
Okay. Can you please go ahead and do it? Okay. And don't let me push your head. Okay. Hold it. Hold it. Relax. Okay. Thank you. So since he was able to perform and do the range of motion looking at the wall, that will be considered a grade 3. And now with the resistance, he was able to resist. He's a grade 5. Now what we're gonna do is the next one. It's called cervical extension. What I want you to do, can you please go ahead and look at the carpet? Okay. And now I'm gonna apply some resistance. Don't let me put your head. Don't stop looking at the carpet, okay? Ready?
Yes.
Okay. Hold it. Hold it. Relax. Okay. Since he was able to resist, he is a grade 5 as well. In case our patient are not able to hold the head against gravity or to look at the wall, there's tests to grade those, okay? Can you please go ahead and lay on your back? For capital, just a little bit, thank you. For the capital extension, what we want the patient to do is when we're gonna place our hands behind the head, palpate on the occipital part, and then we're gonna instruct our patient to look to us, okay? Can you please go ahead and look at my face? Okay, with that, it'll be grade 2. For the cervical extension, what we want him to do is for the patient to place to push on the bottom of our hands. Okay, can you push my fingers to the bed? Okay, so that will consider grade 2. If he wasn't able to perform those exercises, we'll just try to feel the muscle, to palpate in order to grade for 2. For 1 or 0. If you don't feel any contraction on the muscles, it'll be grade 0. Okay. Next muscle manual testing is called capital flexion. What we want to do is for the patient to perform a chin tuck. Can you please go ahead and do a chin tuck, but try not to lift your head from the bed. Is that okay?
Okay.
Okay. Can you try to do it? Okay. Now, since he was able to perform the chin tuck without lifting the head, it's considered a grade 3. Now I'm going to apply some resistance. So let's do the same. I'm going to do a chin tuck, and I'm going to try to apply resistance, and please hold it, okay?
Okay, and not touch the bed, right?
Yeah, try to do not lift your head from the bed, okay?
Ready?
Okay, ready, go. Let it go. Since he's lifting a little bit the head from the bed, he will stay considered on a grade 3, okay? The next one is called cervical flexion. What I want you to do without lifting your shoulders from the bed, try to lift your head and tuck the chin. Can you open to that? Okay. So the next one, I'm going to do the same, apply surge pressure. I'm going to put my hands on your chin. And I'm gonna be pushing you. Don't let me put you against the bed. Okay? Can you do that?
Okay.
Okay. Can you lift your head? Hold it. Hold it. Let it go. Thank you. Okay. Since he was able to perform lift the head, and he was able to resist the force, he'll be considered a grade 5. Okay. The next manual muscle testing is we're gonna isolate the sternocleidomastoid by doing flexion on the neck, okay? What you want to do is instruct our patient, can you please go ahead and lift your head up without lifting up your shoulders and turn to the left, okay? Can you do that? Okay, so good, relax, and then to the other side, we're gonna turn to the right, lift the head, okay. Since he was able to perform that range of motion, it's grade 3. Now what I'm gonna do, we're gonna do the same, we're gonna lift the head up and then turn, but now I'm gonna apply some resistance, okay?
Okay.
Can you turn to the left, please? I'm gonna apply resistance, okay? Hold it, don't let me push you down. Okay, relax. Now we're gonna do the same to the right, okay? Okay, hold it, relax. Okay, since he was able to resist the force, it'll be considered a grade 5. In case our patient couldn't do lift the head and, like we said before, and turn the head and lift the head, what we're gonna do is just while the patient has a head on the bed, just ask them to turn to the left, and we're gonna try to palpate with our 2 fingers the sternocleidomastoid, okay? Try to wide open the fingers so we're able to test that muscle, okay? Can you please go ahead and turn to the left? Without lifting, just on the head, okay? This is because the patient will not be able to lift the head, so we just want to try to feel it. Sorry, let me try it again so to see if you have any contraction of the muscle, if you are able to see it. Can you do it again? If you are able to see it, that will be considered a grade 2. Then can you do it another time to the other side? Okay? Okay, the last test that we are about to perform, it's called cervical rotation. What we're gonna do, instruct our patient to rotate the head to the left side. Can you please go ahead and turn your head to the right side, to the window, without lifting your head from the bed, okay? Good job. Can you go on the center? And then to the right side, okay? Can you go back? And since he was able to perform that rotation, it will be considered grade 3. What we're gonna do next, we're gonna do the same thing, but now I'm gonna apply some resistance, try to come back to the center, okay? Are you ready?
Okay.
Can you please go ahead and turn to the left? Now try to come back to the center, but I'm gonna apply some resistance, okay? Okay, relax, the center, and then on the other side. Okay, can you please go ahead? Okay. Since he was able to resist the force, it will be considered a grade 5. Thank you.